This is Brittany Wastel. This is Anthony. I'm taking my HEENT assessment. Before my assessment, I would wash my hands. Then moving forward, I would go on to my general assessment, looking at Anthony's general build, his general well-being, his hygiene, clothes that he's wearing, things of that nature. After that, I would move on to looking at Anthony's skin and his nails. So just by observing his skin, I can see that there's no abnormalities, no redness, pallor, rashes or anything like that. But to palpate the skin, his skin is dry. His skin is nice and intact. No redness, no rashes noted at all. Looking at Anthony's nails for any edema, clubbing, missing nail beds, they all look to be in good shape. Looks like he uses his hands to work. Moving on, I would look at Anthony's head, hair, skull, scalp, palpating, looking through here. I don't see any masses, scars, lesions. The hair is of equal distribution. Feeling the bones, they all feel good. After feeling the hair, I would move on to Anthony's face, feeling his facial bones here throughout. The temporal artery, good, and then the temporomandibular joint. Can you open and close your mouth? And I'm feeling for a click, or rather the absence of a click. Feeling the frontal sinuses, and then the maxillary sinuses. Moving on, I would look at Anthony's eyes, eyebrows, eyelashes, looking for equal distribution in the eyelashes, the eyelids. I would normally wear gloves in practice, pulling down the eyes, looking at the conjunctiva for any redness, swelling, or irritation. Then moving on, I would look at Anthony's ears, looking at the auricle, the tragus, the mastoid process, and then any surrounding tissues. Normally in practice I would use an otoscope. I would pull up and back on the helix of the ear, insert the otoscope using the light, looking at the tympanic membrane for any redness, irritation, or rupture. Looking at the manubrium umbo and then the malleus. After looking at the ears, I would go on to the nose, palpating the nose for any abnormalities. Anthony does have a prior broken nose. You can kind of feel the bump in there. Using my light, you can go ahead and close your eyes if you want, it will be bright. I pull up and back on the nose, looking at the turbinates or the coil-like structures in the nose, looking at the septum for any deviation. Next, I would check Anthony's nasal patency, having him plug one nostril and breathe in and out. He's a little congested, I can tell that, and then on the other nostril as well. Next, I would move on to the mouth. Looking at the lips, they're nice and pink, plump, no cracked or bleeding lips at all. Having Anthony open his mouth. His oral mucosa is nice and pink and moist. Looking at the uvula, go ahead and open, stick out your tongue and say ah. Ah. I see symmetrical rise and fall of the uvula. I would give Anthony's sinuses a grade 1 plus. They'd have 0 to 25% occlusion for his tonsils. Moving on, I would look at his teeth. Go ahead and give him a big smile. And his gums. I would have gloves on for this as well. After that, I would move on to Anthony's neck, checking for symmetry, any noticeable masses, nodules, scars, lesions, anything like that. I don't see anything with that in Anthony. Moving on, I would palpate his lymph nodes, palpating the pre-auricular, post-auricular, the occipital, submaxillary, the submental, the anterior cervical chain, posterior cervical chain. And then I'd have Anthony go ahead and shrug your shoulders up, feeling the supraclavicular nodes, which I do not feel. And then to conclude, I would look at Anthony's neck, palpate his carotid artery, making sure to do one at a time as to not occlude that and make the patient pass out. And those are nice and strong. Then I would wash my hands and be done with my assessment. Thank you.